So in Kenya, basically we had the first case of coronavirus confirmed on 12th March. And then thereafter, we have had several other cases from 12th March up to today, this afternoon actually. We are at a total of 31 cases. Yeah, from 15th March 2020, we had a lot of restrictions coming in from our president on the guidelines to ensure at least members are safe, gauging from travel restrictions. People are being allowed to come into Kenya, but the difference is it's restricted on how they do come to the country. And also, this is also restricted only to citizens of Kenya and people who have residency in Kenya over the past. The schools and learning institutions were closed. That is from 20th March 2020. We have also had a ban in gatherings, public gatherings, so that it's restricted actually to a number of 15 people in cases of burials and weddings, but there are other forms of gathering like political gatherings. They were actually banned. Also, I can say generally, we have had the government also coming in terms of healthcare, educating people on how to conduct themselves during this time, and the measures to take and the signs concerning corona generally. Apart from gatherings and the rest that I've already mentioned, we have also witnessed scenarios whereby we are told people, once they get to the country, they're told to self-quarantine, but they don't do so, leading to spread of coronavirus. But it has been dealt with, we believe. And I think right now what the government is doing, they're actually forcing people, once you get to the country, you have to undergo a mandatory quarantine, isolation period for around 14 days, either in a hotel or a government facility that has been specified. Also, the very recent thing that the government has done, we have witnessed the government put a curfew on movement. This curfew is supposed to be effective from tomorrow, yes. And also in place, we have had, there's a number, it's 7119. It's a free number whereby members can call when they have issues concerning coronavirus, but mostly to when they suspect a case. That is also one of the measures that in our country you have taken. And then also yesterday we had some major moves that were made by the country to ensure at least the country members are safe. And one of them is the tax implications in the country. Right now, basically there's a reduction that has been made. This reduction is in terms to the income, it is actually 100% tax relief to Kenyans earning below Kenya shillings 24,000. We also have pay-as-you-earn tax reduction from 30% to 25%. We also have a reduction in turnover tax from 3% to 1%. There was also a directive from the government requiring Kenyans to work from home if it's possible. For those whose necessary services are required to the office, they're supposed to go to the office, but they're supposed to maintain the hygiene that is set, the standards of, that are set in terms of curbing coronavirus, that is washing their hands, sanitizing. We have also experienced in terms of the transport industry, or rather the transport sector, there's also a restriction in the number of people in a particular vehicle, moving from one place to another, be it public or private means. And also there is, once you get to a transport system, you're also required to sanitize your hands. And then when coughing also, there have been these lessons on how to cough, how to wash your hands to ensure you don't infect the next person. Persons who are suffering from any form of respiratory diseases, including flus and coughs, are advised to stay at home so that they do not in any way, if they have the virus, affect the rest of the members. So basically, generally, that is what the government has done in Kenya to ensure the spread of coronavirus is at least maintained or rather reduced. Also, yesterday, we had some good news coming in. We have one successful recovery case from Kenya. from the total number of people suffering from coronavirus. So generally what I can state in terms of what perception most people have right now in Kenya, of course, there are those who are of the belief that coronavirus is real, and definitely we need to take caution. But the main concern that these people are having is if you have to stay at home or take these cautions that have been given, then how do we feed? How do we make a living? How do we survive? Many of them, if based on my interaction or the social media conversations that are going on or on ground, is that if they had a means of surviving without going to work, it would have been better for them. But now, most of them are still going to work. As you are aware, the ban is only from 7 p.m. to 5 a.m. That means we have the entire day for people to at least go on with their normal businesses. But also in the rural areas, we are also facing the same problems that Tanzania is facing. There are still people who don't believe coronavirus exists. They do not believe it's there. They just feel like it's some sort of thing that doesn't affect Africans. And if it does affect Africans, then it can't affect them because they are located in other areas. That is the area probably in the coastal region because of the weather there. There are 4 counties basically in Kenya. Let me just wind up with that. There are 4 counties basically in Kenya that have been named to be most affected with this coronavirus. That is Nairobi County, Mombasa County, Kilifi County, and Kwale County. So that is the situation at hand right now. But there's a lot of awareness creation online. Thank you.
Thank you, Ruth. That was very informative. Just to inform everyone who's sharing the brief, let's also keep in time to stick to the 2 minutes because we have the feedback part and the 3 questions to discuss on. We're left with 3 countries. Rwanda.
All right, thank you so much. As Petrida said, my name is Ange Umutoni, and I live in Rwanda. So far, we've realized the first case in Rwanda on 14th of March. That's when we got the first case of COVID, and some measures has been put in place, like we are not allowed to go out of our homes. Instead, when you have an urgent thing to do in town, like for example, if you need to go to the hospital, if you need to go to the market to buy something to eat or some hygiene materials, and again when you are going to the bank or when you're going to work and you're included in those sectors. So otherwise you're not allowed to go out of your place. So again, there are no means of transport. So like, for example, if you want to go somewhere, you just have to walk to a nearby shop. That's where you go to shop. Again, some of the measures, everyone is encouraged to wash our hands and to keep ourselves for the social distancing. So no churches and no weddings, no social gatherings, like at all. We are not allowed to do anything. So even at home, they advise you guys to have 1 meter between yourselves. So it's like that. So well, in Rwanda the case keeps increasing, but we have a hope. Yesterday the day before yesterday, we had a note from Prime Minister saying that all the people who have been affected, that they are actually recovering. So no one which has completely recovered, but we are having that hope that they are not really that much hard, like so sick. So again, well, that is all about Rwanda. So if there is also another Rwandan can supplement. So thank you.
All right, thank you so much, Ange, for being short and clear. Can we get a briefing from Uganda? I think we have Jacob on the line. Is Jacob on? Jacob?
All right, thank you. So hello everyone, sorry for coming in late. I had network issues. I was also trying to get the voicing of the ambassador whom I'm with here, Ivan. And so we're together here. The situation in Uganda is calm, it's collected, it's managed. And the brief is pretty simple. Uganda was one of those last East African countries to confirm late. By late, I mean after the pandemic had moved across many other East African countries. So there's a great deal to learn and a great deal of best practice to ensure takes effect. With that, the government here instituted an immediate pause to what we would call mass gathering avenues, which are the churches and the schools, as a way of curbing the spread of the pandemic if it were to land here. That was before Uganda confirmed her first case. And when Uganda confirmed her first case, it was already in the state of partial lockdown for mass gatherings. And so that's why the cases have not been as a storyline as would have come from the other parts of the world. So we would say Uganda was a bit early in response, and that's a positive thing. For the cases confirmed in Uganda so far stand at 14. That was the first case was confirmed sometime last week. That's around midweek, and that was a case that flew in from Dubai. Yes, from Dubai. And the next phase of cases were confirmed within the space of 2 days thereafter, and that was 8 more cases to bring it to 9. And the last number of cases we've confirmed came in a day later, which was now bringing the total to 14. But notably about Uganda's cases is that one, the cases shot up to a peak of 9. And the third confirmation, which was a beautiful stunt to witness, was that Uganda actually decreased in confirmations going forward, which came from 8 to 4. 1 to 8, then to 5. So it means that Uganda is already on a downward trend. Just yesterday, the brief was that all 104 tested cases as of yesterday were not positive, and that was a thing to smile about and take home in the country. With regard to response and how Uganda is managing the situation, I would classify Uganda's response as a 3-way response. The first is a media outreach, where Uganda is actually using all affordable media platforms from the highest possible office in the land, and that's the president, giving daily briefs on how we can handle the cases and how the country would respond to the pandemic in its existence around the world. And I think that was a very good thing and a strong thing. That helped with this information dissemination. And all media houses have followed suit to just make sure that the pandemic is spoken about on all programs and the masses are cautioned.
So yeah, about I would say about a week and a half ago, just through this COVID-19 news coming out all over the world, we were having debates around what Tanzania is doing, what it's not doing well, how can we prepare, just your normal discussions that we have. So then we were like, I posed the question of why don't we play a role as young professionals in Tanzania? Why don't we do something to help whatever initiatives are being done by the government or other actors? So we decided to at least start this fundraising platform, of which I'll share the link right now. So initially, we wanted to do the immediate things, because we see there was a big gap in like the number of, the masks, hand sanitizer, testing kits was a big issue. But of course, we also didn't want to interfere with ongoing activities that the government is doing and other partners are doing as well, because then we would just be adding to the mess instead of helping out. So, since Dar es Salaam is sort of the epicenter of this outbreak, the majority of the cases are in Dar es Salaam. We decided to, why don't we start, do a grassroots fundraising campaign to at least help around in Dar es Salaam, because it's a city of nearly, I think it's about 8 million people right now, and we have a lot of neighborhoods that are really, really highly densely populated. And currently people are still going about their business. Some people are, self-isolating, but the majority of the population are still out going to work and doing other activities. So people are, as we speak, they're still interacting. So, we decided to start this campaign to fundraise. And so initially we had so many different ideas of what we'll be fundraising for, but we narrowed it down to building permanent wash stations in these high density neighborhoods. And of course, supplying them with liquid soap, because actually the solid soap can actually spread more germs as well, because if they're not washed properly. So building at least about, with our target of 100 million Tanzanian shillings, which is about, I think, I want to say about 25,000 USD, we can build about 50 permanent wash stations around Dar es Salaam. We can supply them with about 2-3 months of liquid soap. And then also we want to provide hand sanitizers to hospitals and medical facilities as well, especially for the people working with patients or the ill, nurses and doctors, and also people who visit these hospitals regularly. So this is how the campaign came about. Currently, where people can donate as low as 1,000 Tanzanian shillings, which is about that's about 40 cents USD. Our target is 100 million shillings, as I said, but we're trying to get as many people involved as possible so people feel a sense of ownership with this campaign. So it officially started about a week and a half ago. We're all volunteering with this campaign. We all have our day jobs. No one is working full time on this. We're just using the Vijana Think Tank network as resources, people to help us share the word, people to speak to their networks as well, so we can get some donations going. We are currently working on also, because only donations we can accept are Tanzanian mobile money donations from M-Pesa and other networks, and also a direct bank deposit. So we are trying to set up maybe, people from the diaspora, people outside of Tanzania who want to support as well, they can donate via Visa, MasterCard, or PayPal. So I'm kind of working with the developer to set that up. But yeah, it's going well. Some challenges that I think I should note, and I think probably maybe other people could face if they're trying to do something similar, is creating legitimacy, because a lot of young Tanzanians are sort of disenfranchised with government, and if they have an inkling or feeling that I think we've managed to fundraise about 3.5 million shillings. That's about $1,500. When we reach about 15% of our target, we're going to start using some of these funds now to contract people to start building, contractors to start building, and for the engagement with local government authorities. Because also, aside from people seeing this as a legitimate cause, it's also working very closely with local government people, because God willing, when this crisis is over, they're the ones who are going to have these wash stations in their communities, and they're going to have to make sure these things have water access. They're supplying them with soap, and people are not abusing the facilities or damaging them. So getting buy-in from all these different people is just as important as raising the money itself. So that's a big thing that we're working on right now. So yeah, guys, I think maybe I've spoken a little too much, but that's kind of the gist of it. It kind of came as a thought, and it's kind of snowballing into now a full-fledged campaign.
All right, thank you. So maybe to start with the update from Uganda is that we're already having a lockdown in effect that started yesterday, but we have so that just brings every initiative that's going on into a whole different perspective. From the brief we had the last time, Uganda was moving on with a volunteer approach for health work necessity from young people, and we're also having fundraisings from young people to effect the procedure. But this was in lieu of necessity and not of the challenges. In the last presidential address last night, we got new directives for the public because of the challenges that ensue with what the young people, or generally all the citizenry, attempt to do in response to this pandemic. So up until now, the response has been more to the effect of trying to help vulnerable societies, access to beach, which has been in fundraising, food items, soap, sanitizers, more like what everyone would think about in the immediate. But with the new reality of the president restricting person-to-person movements and having a ban on all citizenship, all citizen-led possible vulnerable societies, there is need to have a review for all our initiatives going forward in Uganda. What has been happening has been that the young people have been mobilizing themselves in their different identities. Students had a Students Against COVID movement. Universities themselves had arrangements where they were reaching out to communities next to them. Youth organizations were also trying to salvage their own mobilizing capacities internally to be able to reach to rural communities. But all that has to be, the president went as far as saying pandemic for cheap popularity.
politically would risk being arrested and charged with what you call attempted murder. We could forgive him for he's not a lawyer. But the country is trying to centralize efforts to curb the spread of the pandemic by limiting, in so doing, by limiting the presence of any person-to-person motions. So in lieu of that, I think that we would then need, for Uganda's case, interaction can be enhanced, but also how youth initiatives that have erstwhile been there, to fit the current situation analysis. So going forward, I think that one, all the initiatives that have been mobilizing resources and cheap and basic necessities for the populaces that are vulnerable and disadvantaged are going to have to mobilize those directly towards control centers in the Ministry of Health. So the response has a distortion of information does not happen in our response initiatives. The second thing that is going to happen in Uganda is that we are going to have more communication, actual work-based support, and that means that we'll have less interaction between actors in support and the people they are supporting. The third thing that Uganda is doing, having gone into a lockdown now and a curfew for 14 days from effective tonight, Uganda now cannot have any form of purchases facilitated. And so what we are now going to need to do as young people is to refocus our and channel our energies into supporting the centralized system in ways that we can.
And it's a voluntary group that is being used to disseminate information with our available platforms. And that's why many of the organizations we're a part of, EAC Up Uganda, is also designing around that to basically just share information about social distancing and being able to achieve all these measures that are being put in place as the go-to current response system of the world. That's basically how Uganda looks for now. On way forward, we'll have a discussion later.
Thank you, Jacob. I think we are left only with Burundi, and it doesn't have a case of COVID. Jean, did you want to mention anything?
Okay. Can you hear me?
Guiding, then move to action plans and the way forward. Yes.
Can you hear me from Burundi? From Burundi, my name is Jean-Claude from Burundi, and I have to present you the situation here in Burundi. So actually, we have no case. We have no case of COVID-19, and as we are informed by the government, they've taken more measures to protect the safety of the country, and among them, they've cancelled all flights, all air flights, and what is still going on is only the commercial or cargo transport, which are allowed now. And what is the situation now is like everywhere there are a panic, because we cannot understand how the virus is covering all the countries which are bordering Burundi, and we are afraid that in few time we get contaminated with the virus. So rumors and misinformation and more fake news are turning more viral than the COVID itself. But actually, on borders between Burundi and Tanzania, movements are strictly under control. But now, many Burundians who were in Tanzania are entering Burundi illegally. The situation to put them in the quarantine is strengthening them, and they prefer enter Burundi illegally. So those who are entering in Burundi, they have been denounced by the neighbors to the local administration. So as they end up being quarantined, and this is a potential risk that we can be affected by the virus, but the government is still taking measures to protect Burundi, because we see now there is a panic among population and even in rural areas. So in rural areas, because they don't have access to internet or other social medias to be informed at a time,
Okay.
they are more okay. Okay. So one among measures that have been taken is those measures related to the hygiene, and now it's going well here in Bujumbura, and in other areas they are practicing those measures, and we still hope we won't get these cases, because even everywhere that have been announced that there is a COVID-19, it is going down now. So this is the situation that is prevailing in Burundi. Thank
All
you.
right. Jean-Claude, thank you so much for that contribution. It was very useful. I think it all matters on us standing in solidarity as partner states and as Africa as a whole. Just to bring back Aya on board, before we move on to the guiding questions, I just wanted Aya to share a brief overview, debrief of the questions on what is expected from the youth ambassadors in response to this question, so that we can all stick to the main target of responding to these questions.
Thank you very much, Patricia. And thank you everyone for sharing these briefs, which really shows that the challenges we're facing and the responses are very similar. So basically the guiding questions that what we're trying to get out of these is some action points that we could move on and do together, and that would be also practical in many countries. So the first one is how we strengthen innovative communication between institutions and local communities, both online and offline. So there, some of the things that were mentioned is there is a lot of awareness raising, but some of the challenges is people in rural areas, people in settlements. How do we reach out and how do we build that communication bridge? The second question is more about how do we mobilize and organize youth and civil society and their key role in prevention, response, and transformation. And I think all of us here are actors, so we're acting, we're contributing, we're trying to do something, whether it's raising awareness, working with the government, trying to support our communities. But how can we make that more of a massive youth engagement, so every young person in every country feel that they have a role to play and that they need to also be part of these actions of raising awareness and response. And then the third question is really about best practices and learnings that we could share. This is something I've been thinking about, and with the advisory council, on how can we create a hub or a directory of all the African initiatives in different countries, whether from government, whether from youth, whether from civil society. How can we have everything in one place where countries can learn from each other and can accelerate response by sharing these experiences, just like we did right now? Because all of this, there's a lot of information online, it's just overwhelming, but we need to be able to say, this is what Africa is doing, and show some African leadership. So these are mainly the three questions. It's really brainstorming around your ideas. What do you think we should be doing in these three main areas?
Thank you so much. No, I was on mute. I was speaking to myself. Thank you so much, Aya. That was very, very useful. Does anyone have a contribution? I think you can just switch on your mic and start. We are a lot, and let's see how best we can coordinate this. If you give out a response, please direct to which particular question.
My name is Muhumza Umar.
Yes, Umar.
Uganda.
Yes.
I also happen to be a scholar of medicine and surgery. So this largely falls in what I have interest in. One is I'll start with the third question, where we look at how we've managed other epidemics internally, such as the viral hemorrhagic fevers like Ebola and also other RNA viruses like HIV. Now, initially, how we have managed these things in Uganda is by behavior ways. Say, for example, if you look at Ebola, it is behavior. Like we've told people, you know what, you have to stay at home. That's a behavior way of approaching a matter. And it similarly applies for COVID-19. That because you understand that by the nature of the African people, they like to move, they like to socialize. When you tell them to stay at home, then you'll cut the spread of this virus. So this is largely behavior, and I think it can apply either way. For HIV, we told people to abstain, to use condoms, to be faithful. All these were behavioral approaches. For COVID-19, which is an airborne disease similar to other things like pneumonia and the rest, we also adopt a similar approach of behavior. Number two is we have to effect our communication. The largest problem with African society is that we have communication gaps. Each time we release a statement from WHO in English and it is telling people to quarantine, trust me, people do not know what quarantine actually means. If we have to find a mechanism of transferring or disseminating this information into their local languages. And number two, we cannot leave other interest groups left out. Some of them need visual aids and things of that kind. People do not like to read. Even if you release 1,000 statements, trust me, Africans will not read them. Then we can decide to use radios and TVs because you want to cover a wide array. And trust me, there are quite very many myths that have to do with the COVID-19 and all other fevers. If people have not seen this Africa, they think there's a problem. How do we mobilize people? This is I think the first question. Now, the first way of mobilizing people is to have factual information. You must now, one, have a hub that provides you with facts about the disease. After you have had a hub that gives you facts about the disease, the next thing you're supposed to do is disseminate this information to a smaller interest group of people. So these are groups, say experts who know, so they can edit your information. Then the third is now you have representatives in each, say, partner state. If it is for Africa, you know, we have a representative of, say, the African Union. In East Africa, so we have Petrida, we have who, and each one of these people now disseminates the same information to their people such that it can be carried on uniformly from the bigger source to these people down. So this can be done in WhatsApp groups. You could have a WhatsApp group that does all these things. And then also you could harmonize with different governments. A policy that works in Nairobi might not work in Kampala, might not work in Accra, might not work wherever in Addis. So it is how do we have a harmonized position on how to do all these things. And then lastly, not to waste a lot of time, maybe I'll come in if people do not have so much to say, we could have some other things that we could do. Number one, we could have a humanitarian response plan as youths in Africa. So what do I mean here? We shall not always rely on what Jack Ma has to give to our people or a certain group out there. How can we source incomes within our countries so that we can buy personal protective equipment for our people? Because we have very many poor people. 20,000 masks in Uganda are not enough for the population of over 40 million people. So how do we reorganize ourselves in each partner state and solicit funds in a humanitarian way so that we can serve this greater effect? So this is one of the plans. So we can have smaller groups and calls, and we can have where we can solicit money to attack this crisis. Number two, let's have sensitization programs for youths, because remember, you carry the largest population. Each time the youths have a myth, it will be carried on. People, we want to meme around the disease, we want to do this. So we have to change mindsets, and we can only change mindsets if we have the right information. Number three resolution, which I think is that we have to create an environment that inculcates a strong sense of responsibility in the young people of Africa. Now, that can only be done if we are organized as a small group of people. And then lastly, we would think about engaging these people in youths in more productive things. Remember, they have been quarantined and economies are going to shut in one way or the other. It should be our role to foresee this and find ways of how to involve these youths into productive activities. I think I beg to stop here so that other people can also contribute to this discussion. Thank you very much.
Thank you, Uma. That was very, very, very informative and very well explained. I think we've taken on some of those points.